India's battle against tuberculosis, TB, is a dire battle that could redefine global health standards. The government's pledge to eradicate the disease by 2025 has become a rallying cry, yet the reality is far from ideal. In Mumbai's Gavandi neighborhood, where cramped homes and stagnant air create perfect conditions for the spread of TB, families are battling not just illness, but systemic failures in healthcare. This isn't just a local crisis, it's a national failure, with India hosting 27% of the world's TB cases and averaging 2 deaths per 3 minutes from the disease. The stakes are staggering, and the path to elimination seems fraught with obstacles. The government's 2025 target, set by Prime Minister Narendra Modi, 5 years ahead of the World Health Organization's global goal, is a monumental challenge. While the rhetoric is optimistic, experts warn that the plan risks becoming a myth. TB thrives in India's densely populated, poverty-stricken regions, where access to medical care is limited. Even with free testing and treatment, many patients face delays in diagnosis, often only after their condition has advanced to a critical stage. The healthcare system, plagued by underfunding, staff shortages, and outdated facilities, leaves millions vulnerable. Take Mehboob Sheikh, a man who lost his wife to TB a decade ago and now lives with the disease. His story is emblematic of the struggles faced by countless others. Diagnosed 6 months ago, he's been on a 9-month antibiotic regimen, but his body remains frail and recovery is uncertain. His children, malnourished and unable to comprehend their plight, watch as he coughs and struggles to walk. "If my body holds on, I'll keep living," he says, his voice trembling. Yet the cost of survival is immense. His income has dropped to a mere 15,000 rupees a month, and his family's school fees remain unmet. The disease's persistence is exacerbated by a diagnostic gap. Over 75% of TB cases still rely on sputum microscopy, a method that can miss active infections. Modern molecular tests, though more accurate, are used in only 25% of diagnoses. This gap allows untreated infections to fester, leading to drug-resistant strains that are harder to combat. Unless we detect and treat proactively, we'll continue to miss cases, warns Dr. Lancelot Pinto, an expert in respiratory diseases. In Mumbai, health workers like Pramila Pramod report that the number of TB patients has remained stagnant for 10 years. The city's alleys, no cross-ventilation, clogged drains, and overcrowded single-room dwellings create ideal conditions for transmission. Patients often hide their diagnoses to avoid stigma, leaving them isolated and desperate. Sometimes a young girl of marriage age won't tell her parents she has TB, Pramod recalls. How will they find a boy for her? The government's efforts to address this crisis have met resistance. Despite offering free TB testing and medicines through public facilities, progress is slow. India's diagnostic strategy is a major hurdle, with outdated methods and a chronic shortage of radiologists. The pandemic has further compounded these issues, disrupting screenings and diverting health workers. Yet innovation is emerging. AI-powered X-ray devices, mobile testing vans, and drones are being deployed to reach remote communities. Tools like CureAI's chest X-ray software can flag potential TB cases, even in areas with scarce radiologists. However, these technologies cannot replace the need for confirmatory tests, which require labs and time. These machines weigh less than 3.5 kilograms and can be carried in a backpack, says Dr. Shibu Vijayan, CEO of Cure. They run on batteries, so you can screen an entire community in one day without power. Despite these advancements, the road to elimination remains perilous. For those like Mehboob, the fight is a daily battle. His son helps bring medicines home, but no one offers financial aid. "No one has come to help us," he says. "I have no money left. I have to support and feed myself while I'm alive. The question lingers. Can India's government truly meet its 2025 deadline? Will the promise of eradication become a distant dream? Or will the fight for TB inspire a new era of global health? The answer lies in the hands of policymakers, healthcare workers, and the communities they serve. But for now, the battle rages on, with every patient and family fighting to survive in a world where the disease looms as a silent, relentless threat.